Research in spiritual care is important to me because I want to be patient-centered in the care that I provide. When I'm seeking care as a patient, I want to know that my provider is making decisions for me based on what is known through evidence to be as safe and effective as possible. I think the patients I serve should expect the same from me as their chaplain, that the choices I am making in my care reflect the best of what we know about how to provide effective spiritual care.
From chaplaincy research, chaplains can learn the goals of chaplain care and the latest interventions they can use. Patient care is improved, which creates a better financial bottom line for healthcare organizations. Chaplaincy becomes more respected as an evidence-based healthcare profession. Research also helps chaplains see that they are not alone. Other chaplains facing similar circumstances are researching the best ways of providing care.
Spiritual care research helps healthcare teams understand the importance of addressing the deep pain of patients, the deep pain of spiritual and existential distress. Spiritual distress, as we know it, is associated with increased anxiety, depression, and longer length of stay. And without screening, a majority of these patients would go unidentified and unassisted. But here's the cool thing. We've done the research. We have the screening tools. And our next step is just to integrate these spiritual care screening tools into our whole system. That's why I think spiritual care research can be so valuable to our patients and our entire system.
Some people do not fully understand what chaplains do. To be embraced, our work must not only be empathic, compassionate, and professional, it should be evidence-based like other healthcare disciplines. The way to gather that evidence and innovate is through research. Research will provide the data to advocate for our profession. Research also enables chaplains to enhance their skills, enthusiasm, and creativity and avoid burnout and stagnation. That's why I think research is important to the profession of chaplaincy.
If we look at the history of our profession, we see how research from other disciplines, like the social sciences, have influenced our education and our practice. Research in chaplaincy does not mean that all chaplains must be researchers, but rather that we are able to understand research and be able to give a well-informed perspective about how our profession contributes to the well-being of our patients, families, and staff. Who better to give context regarding spirituality and the importance of addressing spirituality than a chaplain? That is why research is important to spiritual care.
Research has long been and continues to be important in shaping an evidence-based delivery of care. It is utilized across all healthcare disciplines to develop best practices and standards of care. We as chaplains have a commitment to research that informs our practice and demonstrates evidence-based spiritual care. It is through research that we can best communicate about our relevance of our practice and advocate for our role in the healthcare system. For myself, I am finding that my engagement with research is bettering my practice of spiritual care and shaping the way I communicate about the efficacy of chaplaincy in my healthcare system.
We know without a doubt that all human beings are spiritual beings and that suffering is part of the human condition. Chaplains are uniquely poised to invite the patient to share their story and to validate the person as a full human being, loved, heard, seen, forgiven, accepted, worthy. It's in researching our interactions and our interventions and reading others' research that we develop evidence-based best practices. Research affirms that evidence-based best chaplain practices leads to improved patient care, improved clinical outcomes, increased staff morale, and reduced staff turnover. And that's why I think chaplaincy research is so important.
Healthcare organizations are trying to achieve the best possible patient outcomes with limited funding. and funding is often directed toward evidence-based practices. As chaplaincy continues to mature as a medical discipline, chaplain research helps us demonstrate our contributions to patient outcomes in ways other members of the interdisciplinary care team can understand. If chaplains as a discipline are unable to demonstrate how our evidence-based practices promote patient well-being, we risk being left behind. And that's why I believe chaplaincy research is so important.
So for my department here at the Menninger Clinic, I'd like to consider the possibility of doing research on the spiritual services that we offer. Now, as a department, we've been tracking our numbers. We know what our department is doing, how many patients we see individually, how many of those come for recurring appointments, how many attend groups, chapel services, etc. It will help my department tremendously if we find out how well we are doing. And we can do this by looking at those patient data outcomes that we already have. By mining those data, we can determine how many of those who engage chaplaincy, and therefore it will give us an idea how well we are doing.
As a chaplain, I am passionate about research. Why? Research helps us to ensure that our practice is the most up-to-date and evidence-based. It is because of research that we can know that the care we are giving is good, doing good, and not harm. Research informs us where we are being effective and where we can improve. And importantly, it can help us identify our cost effectiveness. The research literacy course will really help you as a chaplain be more confident with research and also be part of transforming chaplaincy into a research-based profession. So I encourage you in 3 words, go for it.